In this next presentation, I'm going to show you how to mobilize and manipulate. We'll focus on, say, the middle lumbar spine. And I'm also going to show you a variation called a kickstart technique. So there's a couple of variations from the standard lumbar roll for this one. So what we're going to do first of all is place the foot on the top leg, because the patient's in a sideline position, in the crease of the knee. Use the lower leg to start in a little bit of flexion. Place their hand onto the hip to counterbalance. Then what we're going to do is, let's say we want to, if you go to the PSIs and go across, you know you're going to be in S2, and you find the top of the crest, that's going to be onto L4. So if you say you want to do, say, L3, so I'm going to palpate L2, so I'm going to slowly, when I feel rotation down to the level there, so I'm going to stop. Okay, try not to over rotate and lock everything up. So as soon as you feel a rotation down to the level, you stop from that position. This hand going to go onto the wrist, like here. I normally would bring the head up, so we're looking, relax your arm, just let go. Now from there, so remember I want to go into the middle lumbar, and I said I'm going to use a kickstart technique. So what that means is I'm going to bring my knee over his knee, and I'm going to use my knee to bring him over, and from there, I can literally, these are feeling, okay, my thumb is feeling in here. I'm using my knee on his knee just to mobilize from there. So I'm just mobilizing through that. You might find a lot of patients will cavitate just on that. So that's more of a mobilization technique from there. And if you wanted to cavitate, I'm not going to force anything here, okay? So the manipulation, I normally would say take a breath in. And as I breathe out, from there I would drop, and I use my arm to thrust down through, using my leg as a lever in his knee to continue that movement in there. So it's no more of a drop down through. So that would be a kickstart technique, more for the middle lumbar spine. Thank you.